Hello ladies and gentlemen, my name is Íñigo Iriarte. I want to thank Canon Medical System for inviting me to this congress and the future of the ultrasound and current problems we have in our daily practice. And we also take a look at the past of the ultrasound. Let's go. In 1942 started the first scan with ultrasound of a patient by Carl Theodor Dusik, and he performed the scan of the brain trying to detect this tumor inside the brain. In 1950, first B-mode two-dimensional images with ultrasound machines were created, but they needed an immersion system to obtain these images. This is an image of a tumor of the breast. On 1972, the first paper about pathology of the MSK system was published by McDonald and Davids, and this was the original image in this paper, and they tried to differentiate between thrombophlebitis and Baker's cysts in the posterior side of the knee. In 1990, the machines become more portable and smaller, and also the image was improved with this paper in distinguishing, for example, the Achilles tendon and the posterior side of the ankle. In the 21st century, the quality of the images improved a lot. New systems bring us this quality of images of the gastrocnemius and soleus muscle with this small scar tissue on the soleus. So in the 21st century, the ultrasound was very useful in MSK practice. In 2010, machines became more and more sophisticated with this improvement in the quality. Now you can see very accurately the gastrocnemius medialis with this injury, this tennis leg here, the scar forming here with this hypoechoic image between the soleus and the gastrocnemius and soleus. So now we have a very, very good image, and it's still improving with new techniques. This image is again a gastrocnemius or tennis leg and the soleus, and you can see here the resolution improve of this area and how we can distinguish the fibers inside the muscle, so we can have a very, very accurate diagnosis with ultrasound. Another phenomenon occurred in the 21st century is that before only radiologists perform ultrasound in MSK system, but last 10 years other specialists have started performing ultrasound. Sports physicians, rehabilitation specialists, traumatologists, rheumatologists, general practitioners, and others. So the knowledge in our clinical practice has increased a lot, the knowledge in MSK ultrasound. So where are we just right now? From high frequency probes, 18 MHz, now we have ultra high frequency probes, 22, 24 MHz, but usually in MSK we use 20, 21 MHz. So the resolution of the images are astonishing. So this is a 3 Tesla's image of an extensor tendon at the metacarpophalangeal joint, with the affection of this sagittal band. And this is the image with ultrasound. You can see how accurately we can see the tendon, the sagittal bands. This is the edema in the affected side, and we can use the dynamic maneuvers, and you can see the luxation of the tendon. So now ultrasound has the best quality of image than other technique in image. So the better image is provided by ultrasound. Another example, this is my toe. It was this summer accident surfing. This is the normal toe on my contralateral side. You can see the movement of the phalanx and how the tendon, which has a thickness of less than 1 millimeter, moves without problems. And this is the affected side with this hypoechoic thickening of the tendon, the void between the tendon and the phalanx, and the absence of movement with the phalanx flexion. Okay, so very, very accurate diagnosis with ultrasound. This is a 22 MHz probe. Another example, this is a patient with injury in the anterior side of the forearm. You can see here the atrophy of the tenar eminence. And with ultrasound, we can check that the median nerve is affected, but small fascicles here on depth are still present. So there's no other technique that can tell us such information about a nerve injury or these structures. Okay? You can see here the fascicles, and in the long axis, again, this is the median nerve. You can see here the affection, the scar, and here these deep fascicles still in continuity and without affection, okay, without injury. So a very, very accurate imaging. Other tools, Power Doppler has evolved to super microvascular imaging, for example. Now we can check the changes in the vessels inside the tendon with such precision, okay? And we don't know yet if these vessels are a problem or part of the solution, but we can now have a better study of these tendons and try to understand better the physiopathology. Ultrasound-guided procedures are widespread used. This is an example of the tennis leg again with this huge hematoma in an athlete. We can use ultrasound to evacuate the hematoma. We can place the needle with total precision. Now we can, without risks, evacuate the hematoma. You can see here 22 centimeters, 44, 66, and almost 80 centimeters of blood between these two muscles, the gastrocnemius and the soleus. As you can imagine, this will lead to a great big scar and functional problems, but if we remove the hematoma, a better outcome will be expected. Okay. Other possibility, for example, trigger finger, a very common pathology with this snap of the flexor tendon below the A1 pulley, okay, which changes with metaplasia and becomes thicker too. And this is the diagnosis. As you can see, the snapping of the flexor tendon below the pulley. This is the T1 pulley because this is the thumb. Okay, a good image with dynamic movements, and we can use ultrasound to perform this procedure and place the probe with total precision, touching the tendon but without perforating it, and placing the corticosteroid into the sheath. Okay, you can see here how accurate is this image. Okay, and we can finish with some perforations of the A1 pulley here, trying to get the atrophy of this pulley, trying to avoid new the beginning again of the snapping after the injection. Okay. Last example, this was a patient with a surgery of the decurvens tenosynovitis here. You can see here the superficial branch of the radial nerve. This is 1 centimeter, so this nerve has 1.5 millimeters more or less. And you can see here this fascicle trapped into the scar here, okay? And the patient has burning pain in the radial territory, okay, in the skin. We tried with rehabilitation techniques with no results at 8 weeks. So we performed this ultrasound guided procedure, trying to release this fascicle here injecting corticosteroids inside the scar, and you can see here, puff, this is snapping here, this is the release of the nerve, and a total recovery 3 days after the procedure. So now ultrasound is very useful. We have a good quality of image, outstanding quality of images, but where will we go? There are still some issues with ultrasound. For example, some injuries like deep tendon injuries. This is the rectus femoris injury of the central tendon. It's difficult to distinguish which part is the tendon, which part is edema with ultrasound, but with the fusion we can understand better this injury and we can learn how it behaves during its evolution, and we try to understand better this injury. So fusion is very interesting on the learning of the ultrasound and to use in some deep procedures, okay? But for now, it's technically difficult to perform. It's very demanding technically, so it's not used widespread. Another example is the elastography, a promising tool used in liver or kidney or breast for detecting the tumors and its elasticity. And we can use also in MSK procedures. This is an example of a patellar tendinopathy. And if we use elastography, we can notice how the deep portion of the tendon is softer and harder the superficial part. It helps us to distinguish from pathologies and its behavior, but it's still very difficult to have conclusions on how this technique can help us in MSK pathologies. Perhaps with the shear wave technique of elastography, with these quantitative measurements of the elasticity, we will have better knowledge of the tendons, but it's still a promising tool not implemented at the present. Okay, so the surgery has become to be with us. This is an example of strapping of the Achilles tendon and with a guided ultrasound, with the ultrasound guiding the procedure. Okay. Other techniques can be performed guided by ultrasound. For example, this is a paper, a recent paper publishing the technique to repair a complete tear of the Achilles tendon with ultrasound. And this is the release of the carpal tunnel syndrome with the ultrasound and this special tool here created for this purpose. So sonosurgery has started and is evolving very quick because it's very useful to have this inside view with the ultrasound. So is it possible to learn ultrasound nowadays? There's too much knowledge, we know. Ultrasound needs a long learning curve. Ultrasound is continually evolving, so we must be updated. And this is the dynamic technique. So normal books are not enough to learn ultrasound. New tools are needed. These new tools need to be accessible, affordable, of high quality. We need to access the information wherever we are or whenever we want, and with high quality contents, because we have some things in the internet, but not of good quality for now. And easy to understand. That's why Canon and I are working together trying to create new tools, learning these high quality anatomic videos explaining the structures we are going to see at the ultrasound. The same person explains the anatomy and the sonoanatomy with these high quality drawings. And after that, once we have understood the anatomy and the sonoanatomy, we show the pathology. Okay. So conclusions. Ultrasound has had an outstanding evolution last 25 years. Now we have an amazing resolution and we can see very accurately structures in the MSK system. This is an example of this this fascicle here of 0.25 millimeters. Okay? We can use this ultrasound very safely to perform ultrasound-guided procedures. There's an exponential implantation among clinicians, so the ultrasound is now very present in our daily consultation and very, very useful. This knowledge has increased a lot because all these causes here. We know now a lot about ultrasound in skin pathologies, and we need new learning tools to learn all these changes. All these subjects have changed a lot last 10 years, and we need to change our systems of learning ultrasound. But it's worth it, I assure you. We have to check the past, the present, and the future of ultrasound, an amazing tool for superficial structures with an outstanding resolution and very, very useful in our daily practice. But there are still some problems with ultrasound. On depth, we don't have enough resolution to diagnose some pathologies, and sometimes the patients have not a good transmission of ultrasound. So in some patients it's difficult to have a good image. Also, intra-articular structures are hidden to the ultrasound. I hope in the future all these issues will be resolved, and ultrasound gets even better. Thank you very much.